thanks for coming to our virtual visit day to day. Today we're going to be highlighting our respiratory care program. We have Amy Rausch, who was willing to pop on here and participate. So you're going to hear from her. She is the respiratory care instructor. So she's going to share her screen and do a presentation for you guys, hopefully answer some questions you have, so you guys can get a little sneak peek of what our respiratory care program is all about. My name is Bailey Hemingway. I'm an admissions representative on the Piasta campus. With me today is Josh Shimmick. He is an admissions representative on our Kalmar campus, which is about 2 hours north of Piasta. So without further ado, we're going to get started. Just some general housekeeping so everybody is comfortable with Zoom. If you do have a question, please put it in the chat box. So if you hover your mouse over your screen on the bottom, there should be a chat box option. Josh will actually be monitoring that. So if you leave questions, he will get those answered, or we can answer them at the end as well. You also have a raise your hand option, but if you don't feel comfortable doing that, just put your questions in the chat box. We are going to keep you unmuted for today, just so we don't hear your background noise or anything like that. But if you do want to ask a question, we can unmute you and you can ask your question. Our agenda for today, I'm getting through the welcome right now. Then we're going to turn it over to Amy, and she's going to talk about our respiratory care program. Then we're going to give you guys a chance before Amy logs off to answer any questions and to ask any questions so Amy can get those answered. After that, I'm going to go through some admissions and college information, and then we're going to switch gears. Josh is going to take over, talk about financial aid. I'll talk about next steps, and then at the very end, we're going to give you guys a chance to ask some more questions again. Hopefully get those answered for you. We also have a survey that you guys can take. There is a free t-shirt included for anyone who fills it out. Please take a couple of minutes and fill this out. We want to know the best way to serve you guys. Any feedback is encouraged and welcomed. So just a little introductory to the respiratory care program. The instructor, as I mentioned before, is Amy Rausch, who's with us today. It is an Associate of Applied Science, so that's going to be a 2-year degree. It is designed to get you employed after 2 years. That's not to say that you can't transfer onto a 4-year, but it is designed primarily to get you employed after 2 years in this field. The applied is the key word in that award. So we want to provide you with the applied knowledge, skills, training for you to go out into the workforce in this specific field of work. It's located on the Piasta campus. If you're more familiar with Dubuque, it's about 15 minutes from Dubuque, Iowa. And it is a fall entry only. So you cannot start this program in the spring. Okay, I'm going to stop sharing my screen, give Amy a chance to share hers, and we can hear from her.
Okay, can you see my screen okay?
Yep.
Okay, like Bailey said, my name's Amy Rausch and I am the program director for the respiratory care program. My contact information is on the screen if you need to get a hold of me. The best way probably for the summer semester is through email, and my email address is right there. It's rauscha@nicc.edu. All right, so we'll kind of go and talk about a little bit about what respiratory care is. Not many people are familiar with the profession, and a lot of times we do get kind of confused with nursing, but we are a little bit more specific in that we take care of patients that have heart and lung disorders. The heart and the lungs kind of work together, so we deal with those types of patients. Our patient population has increased quite a bit during this pandemic because the COVID-19 virus does affect the lungs. So the types of patients that we see, most of the time we are working in the hospital, and we treat patients with asthma, COPD or emphysema, which is the disease caused from long-term smoking. We take care of premature babies. The lung is actually the last organ to fully develop in utero, so most babies that are born premature will have lung problems. Cystic fibrosis, that's the disease it's a genetic disease which causes thick, sticky mucus to get trapped in the lungs, and then that grows bacteria. Pneumonia, bronchitis. We are in the trauma team, so we take care of patients that come in with chest trauma. We take care of patients with lung cancer, and then of course with this pandemic going on, we've been seeing COVID-19 patients as well. So every day is different. Kind of unlike nursing, who kind of stays in one area of the hospital, we have a respiratory therapy department, and then we kind of disperse throughout the whole entire hospital. So you'll see all kinds of different patients in any given day. So of course, we do take care of our chronic lung patients, and we do daily aerosol and oxygen treatments for our patients like our asthmatics, emphysema, chronic bronchitis, our chronic lung patients. We typically see them in the hospital every 4 hours and do what's called rounds. And during rounds, we just check their oxygenation status, give them any medications that they would need for breathing and things like that. We also take care of post-surgical patients. We do breathing exercises with them to make sure that their lungs stay inflated. And then we titrate their oxygen. So we try to get them off of the oxygen that they were on maybe while they were having their surgery. Most of our job is done with critical care. So we are in the intensive care units. We either do the intubations or assist with the intubations, and that's where they put a breathing tube into the trachea. And then we initiate and control the mechanical ventilators that will do the breathing for the patients when they can't breathe on their own. We're also responsible for keeping those airways clear. So if they have a lot of secretions or anything like that, we will suction those out so that their airways stay clear so that they can breathe better. We're also in the neonatal intensive care unit and take care of babies. We do assist in the resuscitation of the newborn babies and any ventilation that they may have. So if they're going to be put on mechanical ventilators, we would initiate those for the babies as well. We're also on the transport team, so we'll prepare any infants or newborns who maybe need to be transferred to a bigger facility. So maybe if they're born in a smaller hospital and we need to take them to, let's just say the University of Iowa, we would get them intubated and get them secure so that they can be transported safely. We're also on the diagnostic team, so we assist in what's called a bronchoscopy. A bronchoscopy is where they take a scope and they'll go into a patient's airway, and they're looking for things like they can biopsy tissue for lung cancer. They're looking to see if they have a lot of secretions and they can get those out. They'll also look at the vocal cords to make sure that they don't have any like vocal cord paralysis or anything like that. We also perform arterial blood gases, and arterial blood gases is drawing blood from an artery. So we'll draw blood generally in the patient's wrist where they have the radial artery. We also perform what's called pulmonary function tests, and pulmonary function tests are where the patient can go into a lab and we'll look at their lung volumes and their capacities. That will kind of tell us if their disease is getting worse, if it's getting better, if their lungs are okay enough to go into surgery, things like that. We're also on all of the critical care teams. So we are on the trauma team. So if there's a trauma called in the hospital, we do respond to that. And we're always responsible for the airway of that patient. Our respiratory therapists are on the rapid response team. The rapid response team is a team that is initiated in the hospital. If a patient looks like they're gonna code, we try to get to them before they do code and get them stabilized. We're also on the code team. So if somebody does stop breathing or their heart stops in the hospital, we respond as part of that team as well. And then we are on the transport team. So we transport either by ambulance, by helicopter, depending on the situation of the patient. We also are involved in education through our pulmonary and cardiac rehab programs. So this is where our chronic lung patients can come into the hospital and we can have them exercise and teach them how to breathe properly while they're doing certain tasks. We'll also educate them on any medications that they're taking at home. We'll actually educate them on their disease and their disease process. It won't cure their disease, but it'll make their quality of life a lot better, and it will help them manage all of their medications that they're taking. We also do smoking cessation if they are still smoking. And then we do have an asthma educator program, and an asthma educator works with kids with asthma and their family members to help them control their asthma, see what triggers their asthma and things like that. We're also heavily involved in sleep medicine. Polysomnography is doing sleep studies. So a patient would come into the hospital, we will hook them up on lots of different leads, and then we'll watch their brain waves and their breathing while they're sleeping. And then if they are diagnosed with sleep apnea, then they go home on a CPAP machine and we help the patient set those up and teach them how to use those machines. Some classes to take in high school if you're interested in any health field would be as many science courses as you can take. So anatomy and physiology, chemistry, biology, those are all good classes to take in high school. Also math courses, so algebra, statistics. Anatomy and Physiology 1 with the lab is a prerequisite to enter our respiratory care program. The outlook, the need for respiratory care professionals is expected to grow, and that's due to the increase in our elderly population, an increase in the number of patients that are being diagnosed with asthma, and technological advances in the treatment of heart attacks, cancer, and premature babies. Respiratory therapy was rated number 4 as Chicago area top 10 hottest jobs, and that's by Crain's Chicago Business Newspaper. The job outlook, according to the Bureau of Labor Statistics, for 2018 to 2028, we're looking at about a 21% growth in the profession, which is much faster than all of the jobs, which averages about 5% growth. Median pay for 2019 was about $61,000, about $29.50 per hour. Our program at NACC does have that prerequisite of Anatomy and Physiology 1 with the lab. Our program is 21 months long, which equals about 5 semesters. Our clinical sites that we use are Mercy One in Dubuque and Clinton, Unity Point Finley Hospital, which is in Dubuque. We do go to the University of Iowa in Iowa City, the University of Wisconsin in Madison, and Regional Medical Center, which is a small community hospital in Manchester. Our students do graduate with an Associate of Applied Science degree, and that makes them eligible then to take the national board exam. So after graduation, there is a board exam just like other healthcare professionals would need to take. We do prepare you for those board exams through the 5 semesters of the program. The respiratory care program does have articulation agreements with some four-year colleges if you wanted to just pursue a bachelor's degree either in respiratory therapy or in some sort of health science area. Our ed plan at NACC for the first semester would include Anatomy and Physiology 2, unless you've already taken it. You wouldn't have to take it again. Respiratory Therapy Techniques 1, which includes 96 hours of clinical. Respiratory Therapy Science 1, and the college experience. Again, the classes with the asterisks by them are classes you could take before you come into the program. In our spring semester, we have Math for Liberal Arts, Respiratory Science 2, and Respiratory Therapy Techniques 2, and the Techniques 2 course includes 192 clinical hours. Our summer semesters, these do have the option of taking all 3 of these courses online. Intro to Psychology, Pulmonary Pathology, which includes 192 clinical hours, and Composition 1. In our 4th semester, we have Microbiology, Microbiology Lab, the Neonatal and Pediatric Respiratory Therapy course, and Respiratory Therapy Techniques 4, which includes 240 hours of clinical time. And then our last semester includes Advanced Life Support. So before our students graduate, they will be certified in ACLS and PALS, Advanced Cardiac Life Support, and Pediatric Advanced Life Support. The Respiratory Care Professional, Respiratory Therapy Techniques 5, which includes 176 hours of clinical and 160 hours of externship, and then Innovations in Respiratory Care for a total of 77.5 credits. Any questions?
I know you briefly mentioned job placement. Obviously, it's very high and good. Amy, where do you see a lot of your students getting employed?
It kind of depends. A lot of them go to the University of Iowa just because once they do clinicals there, they really enjoy it. And so if there's job openings there, they tend to go there. Dubuque Hospitals, Mercy and Finley just recently had some full-time openings. So some of our students got employed there. A lot of them do go to the University of Wisconsin as well. Once they get into those bigger hospitals, they really enjoy that kind of therapy. So they tend to kind of gravitate towards those areas. Some of them are going to the Quad Cities. There seems to be a lot of openings at Genesis Medical Center and Trinity, both in the Quad Cities. Clinton, Mercy One in Clinton just hired one of our students full-time. I get probably at least one job opening probably a week, asking and begging me. Des Moines, they go to Des Moines, Waterloo. there is a really big shortage right now, so people are constantly contacting me with job openings.
That's awesome to hear. Sorry, Josh, go ahead.
Sorry, Bailey. One of the things that struck me in your presentation was the amount of clinical hours that the students get over the course of their time at NACC. Do you find that when the students come back from clinicals that there are good conversations and that it's just a good partnership that way in class and the clinicals?
Absolutely. So what we do in class is before they can do anything in the clinical setting, we have to check off in the lab on our mannequins. But once, you know, they can get out into the clinical and actually see kind of what we're talking about in class, everything kind of comes together and clicks a little bit better. And then, yes, of course, they bring to class any, you know, unique cases that they saw in the hospital, leaving out patient names and identifiers and things like that. And then we can discuss those, and those are always good learning tools that they bring back to the class. And I think clinicals is where the majority of our education takes place. So we have really good relationships with our clinical sites.
Awesome. Just a follow-up question on the clinical sites, and you listed them all there. A lot of opportunities. Do the students have kind of a choice on where they go based on like their location and things like that?
Yes, so if we get our students that come from, we do have a consortium with Eastern Iowa Community College. So if we get students from that area, I tend to try to keep them at Clinton and the University of Iowa just because they're a little bit closer. Once in a while, they will ask to come to Dubuque for maybe a few days and to go to the University of Wisconsin just so that they can get those experiences. But we try to tend to kind of give them some options to keep them closer to where they live. Yes.
Awesome. Thanks.
And it's awesome that you have articulation agreements with some colleges and universities just for, you know, sake of security, knowing that your credits will transfer to pursue that respiratory degree.
Right.
In batch. Yep. Cool. Awesome.
A hospital just recently, I'll just kind of bring this up because I'm hoping it'll happen more,
yeah,
who
please.
is willing to pay tuition for 2 students to come through the respiratory care program. And then of course they would sign then a contract to work for that hospital after graduation. So
wow.
That's
awesome.
Some of that stuff as well.
Very cool. Well, thank you so much for willing to participate in today's virtual visit day, Amy. I appreciate it. If nobody else has questions, you are free to log out.
Okay. Thank you so much.
Yeah. Have a great day.
You too.
Same.
Bye.
Bye. Okay. I will share my screen here again. Can everybody see my screen?
Yes.
Perfect. Awesome. Okay, so we'll just keep this going, guys. Some facts about NACC. We do have 70 programs, one of which we did highlight today, the Respiratory Care program. We have a little bit of something for everybody. We also have 8 locations, so whether the thought of moving hours away after high school is scary or whether you're counting down the minutes, we do have options for you with our many locations. Just keep in mind that some programs, like the Respiratory Care program, is only located on certain campuses. In this case, it's only located on the Piasta campus, which is 15 minutes west of Dubuque. Our other locations are Kalmar, which is 2 hours up north, closer to Decorah, Iowa, if you're familiar with Decorah, Cresco, Dubuque, Manchester, New Hampton, Owine, and Waukon. We also have different ways you can take your courses. We understand your schedules are unique and they're different, just like you are, and we want to accommodate all walks of life when it comes to that. So we do have online classes, we have traditional face-to-face classes, and we've got hybrid classes, which are part online, part in person. So maybe you wouldn't have to come to campus every single day, which is very beneficial, especially if you have a longer commute. We also have 8 to 10 week class sessions. Those are a little bit more time condensed, time sensitive. And then we have our Z course programs, which are online, 8 weeks and no textbook costs. That's where the Z comes from. In Z course, it stands for 0. Some more facts about NACC. Our average class size is 14. We do that intentionally. With less students in the classroom, leaves more room for participation, engagement, asking questions, and getting to know your instructor. all of our instructors want to get to know you. You were able to meet one of them today. They all want your best interests at heart, and they know you're not just a face or a number. You're a person with dreams, aspirations, fears, concerns. So they really want to get to know you at NICC. We do have a little over 6,000 students. Keep in mind that does take into consideration our 2 campuses, our service locations, online and part-time students. So it's never gonna feel congested or like there's 6,000 students on campus. You do have a lot of support at NICC. So upon acceptance, you'll be assigned an advisor. This advisor is gonna be the one to sit down with you, create a game plan, an educational plan, and register you for classes. They're probably gonna be the most consistent person to you at NICC. We also have career services. This will be a little bit more relevant to you at the beginning and at the end of your time at NICC, and obviously you can utilize it in between as well. More so in the beginning, if let's say you didn't want to fully commit to being a respiratory therapist before you really knew a day in the life of a respiratory therapist, we could hook you up with an employer and you could do a job shadow for the day. More so at the end, when you're getting ready to go out into the workforce or transfer to a 4-year, we can help you build on an existing resume or create a resume, and we also can conduct mock interviews for you, hook you up with some internships, that kind of thing. Come back as an alum, and you can still use these services for free. We do have a mental health counselor on both campuses. So if you ever need somebody to talk to, whether that be academic, personal, whatever the case may be, there's always going to be somebody there to support you, talk with you, feel with you, those kind of things. We also want to provide you with the necessary resources for you to be successful at NICC. So if you do need certain accommodations, if you got certain accommodations in high school, we'll honor those and you'll receive those same accommodations at NICC. You just need to let us know. We're never going to ask you. We also have a learning and a writing center on campus. It's free tutoring. It's not going to be your fellow NICC classmates tutoring you. It's going to be full-time paid professionals. So you've got a writing person, a math person, a science person. We've got a registered nurse who works in there with our nursing students. So it truly is full-time paid professionals who will be tutoring you and helping you out. A little bit of life outside the classroom, because it can't all be academic. It's a fun atmosphere on campus all year round. We have a group called Impact, which anybody can join, and their main purpose is to bring fun things to the campus every other week. We do have a sports shooting team. If you're not familiar with sports shooting, it's shooting clay pigeons. We throw a fall fest on our Kalmar campus every year. It's basically just a huge outdoor festival. We play intramurals against the University of Dubuque. Makes it a little bit more competitive. You're not just playing against your fellow NICC classmates. We have fitness centers on both campuses. They're not owned by NICC, but the one in Piasta is right down the road, and that's free for students to use in between classes, after classes, before classes. And then also up in Kalmar, there's one called Results, and you also get a discount at that one as well. We take a service trip every single spring. This past spring, they went to Phoenix, Arizona. In past years, they've been to Washington, D.C., Nashville, Tennessee. So it's a really good way to have fun while also helping out a different community and lending a hand to them. Very rewarding type of trip. Kids from both campuses go, and so it's a chance for you guys to meet friends as well. Now we're going to switch gears. I'm going to hand it off to Josh. He's going to talk a little bit about financial aid.
Yes, thanks, Bailey. Just a couple thoughts on the financial aid front. In full disclosure, I work in admissions and I talk about financial aid and I help students with their FAFSA and whatnot, but I am not an expert. We do have many experts across the district and at both campuses that are always eagerly awaiting to help students and prospective students just kind of work through the financial aid process. As you can see on the screen, we are a very affordable institution. Through this summer of 2020, our in-state tuition and fees are $198 per credit. So for a 3-credit class, you're paying just a little under $600. As Bailey mentioned earlier in the presentation, we're a pay-for-credit institution. So all of those other support systems that we have in place to help you, and some things including free parking and free testing and whatnot, we don't charge you for those extra supports. So as you see on the bottom left, our estimated annual tuition is about a little over $5,000. And then you can see there on the screen in comparison to the public colleges, the UNIs, Iowa State, and then further right, the private four-year institutions, the Luthers, the Wartburgs, the University of Dubuque. So we're very affordable and we're very student-centered and student-focused. So we kind of have the best of both worlds there. So like I said, some things that are included in your tuition and fees, what we're showing on the screen there, the application, the testing, graduation parking, tutoring, and all of those other things. So thanks, Bailey.
You bet.
So 5 numbered items on this screen here. The biggest one is the first one. You want to submit your free application for federal student aid, really as soon as you have the chance. So the FAFSA opens up to high school seniors and to folks October 1st annually. So if you're viewing this presentation, you're thinking respiratory therapy, respiratory care for this fall upcoming, I would strongly encourage you to complete your FAFSA by July 1st. So you have a few weeks left to get that done, but what that does is it qualifies you for, on number 3, the state of Iowa grants that need the FAFSA on file before July 1st. So we also have some fantastic scholarships in-house at Northeast Iowa Community College. So go on our website and take a look at that. You complete one form and you're evaluated for all of our many scholarships. So the priority deadline says April 1st, but please still go ahead and do that. Folks get reviewed 3 times a year. So, and then like I said, financial aid is available in the form of those grants, scholarships, student loans if you need, and work study. Bottom of the screen, you can see some of the quick facts. Over $12 million of financial aid is awarded. Almost 3/4 of all NICC students complete that FAFSA and receive financial aid. And those NICC scholarships I talked about, over $165,000 are awarded to students as well. So lots of opportunities to help out with the cost of college. The last dollar scholarship, you can see all the programs on the screen here that are last dollar scholarship eligible programs, from agriculture business down to welding on the bottom right. These programs, if you complete your FAFSA before July 1st and you enroll, you meet the criteria to enroll either part-time or full-time depending on your age, then you can take these programs at no cost. So the last dollar scholarship will cover tuition and fees outstanding after the Pell Grant steps in. So really a fantastic deal. Tune in on June 24th. We'll be talking a little bit about last dollar scholarship. You can always call as well to get more information on that. So back to you, Bailey.
Awesome. Thanks, Josh. Sorry, I was skipping screens there for a minute. So if you guys are gung-ho, if you believe NICC is the best choice for you, displayed out on the screen right now is going to be your next steps. So number 1 is going to be to apply. You can apply online. It's free to apply. You're going to want to submit your FAFSA and apply for scholarships. Like Josh mentioned, do this right away, because the sooner you get this filled out, possibly the more money you'll be able to receive in grants and scholarships, especially that last dollar scholarship. If you wait until after July 1st to fill out your FAFSA for this upcoming school year, you'll miss out on the opportunity to possibly get your tuition covered. So definitely fill out your FAFSA and do it as soon as possible. As Josh mentioned, it opens up October 1st of every single year. You're going to want to send your transcripts to the college. This will allow us to evaluate your academic background and determine if you can be waived out of anything or if anything from your academic background can be carried over to NICC. We also have placement assessments, reading, writing, and math. If you took the ACT or the SAT in high school, that's great. We'll take those scores, but it is not required. We have our own entry tests. Like I mentioned, reading, writing, and math just depends on the program. Some programs require to take all 3. Some of them only require reading. After that, you're going to want to meet with your advisor and get registered for classes, pay for tuition, and head to class. We hope you guys enjoyed your visit. If you don't have any questions, we do have a question and answer session right now. Feel free to, like I said, ask any questions in the chat box. But if you don't have any questions, thank you so much for popping in and have a great week. Thank you.